If you are over the age of 60 and have started to notice tingling in your feet, numbness in your fingers, or a strange burning sensation that wasn't there before, you are not alone, and more importantly, you are not imagining it. I have spent the last 23 years caring for adults in their 60s, 70s, and beyond, and one of the most common concerns I hear from my patients is this quiet, persistent change in how their body feels. It often begins subtly. Perhaps your toes feel less sensitive when you touch the floor in the morning. Perhaps your hands feel slightly clumsy when buttoning a shirt. Or perhaps there is a faint tingling sensation that comes and goes without warning. These changes can be confusing and sometimes even unsettling, especially when they appear without a clear cause. What many people do not realize is that these sensations are often connected to the health of your nerves. Your nerves are responsible for carrying signals between your brain and the rest of your body. They allow you to feel temperature, pressure, and pain. They help control your muscles so you can walk steadily, hold objects securely, and maintain balance. In many ways, your nerves are the communication network that keeps your body functioning smoothly and safely. As we age, however, this communication network can become more vulnerable. The body's natural ability to maintain and support nerve health changes over time. This is not a sign of weakness or failure. It is simply a reflection of how the human body evolves with age. The same resilience that allowed your body to recover quickly in your 30s or 40s may not function in exactly the same way in your 60s or 70s. This is a normal part of aging, but it does not mean these changes should be ignored. Some people dismiss these sensations as just getting older. And while aging does play a role, there are deeper biological reasons behind these changes. Your nerves depend on proper nourishment and internal support to function effectively. Over time, the systems that protect and sustain nerve cells can become less efficient. This can lead to slower nerve communication, reduced sensitivity, and, in some cases, discomfort or imbalance. I understand that when you hear claims about repairing nerve damage quickly or with something as simple as a daily vitamin, it can sound too good to be true. And your skepticism is understandable. In medicine, we must always be careful, thoughtful, and guided by science. There are no miracles, and there are no instant transformations. However, what we do know is that your nervous system is a living, dynamic part of your body. It has the capacity to respond to changes in its environment, especially when it receives the proper support. After the age of 60, your body's nutritional needs can shift. The way your body absorbs and uses certain nutrients may not be as efficient as it once was. This is not something you can see or feel immediately, but over time, it can influence how well your nerves function. Many of my patients are surprised to learn that subtle nutritional changes can have a meaningful impact on how their nervous system performs. This matters because nerve health is directly connected to your independence and your quality of life. Your ability to walk safely, to feel stable when standing, to hold a cup without dropping it, or to sense the ground beneath your feet all depend on healthy nerve communication. When nerve function begins to decline, even gradually, it can affect confidence, mobility, and comfort in everyday activities. I have seen patients who felt frustrated and worried because they did not understand why their body felt different. Some feared the worst. Others ignored the symptoms entirely, hoping they would go away. But the truth is, understanding what is happening inside your body is one of the most powerful steps toward protecting your long-term health. When you understand the role of your nerves and how aging influences them, these sensations become less mysterious and less frightening. You deserve clear, honest information about what is happening in your body. You deserve to understand why these changes occur and what factors may influence them. Aging does not mean losing control over your health. It means becoming more aware, more informed, and more attentive to the signals your body is sending you. To understand why nerve health becomes more fragile after the age of 60, it helps to first picture what a nerve actually is. A nerve is not just a single thread. It is more like an insulated electrical wire. Inside that wire is a delicate core that carries signals, and around it is a protective covering called myelin. This protective layer helps signals travel quickly and smoothly, just like the plastic coating around an electrical cable helps electricity move safely and efficiently. When this protective layer is strong and intact, signals move clearly. When it becomes thinner or weaker, signals can slow down, become distorted, or sometimes fail to reach their destination. One of the first important changes that occurs with aging involves this protective covering. Over time, the body may produce and maintain myelin less efficiently. This does not happen suddenly, but gradually. Imagine an old electrical cord that has been used for decades. The outer coating may become slightly worn. It may still work, but not as perfectly as before. In your body, when the protective layer around nerves is not as strong, signals from your brain to your feet or hands may become slower or less precise. This is one reason why sensations such as tingling or numbness can develop. The second key mechanism involves the nerve cells themselves and how they generate energy. Every cell in your body, including nerve cells, depends on energy to function. This energy is produced inside tiny structures called mitochondria, which act like miniature power plants. As we age, these energy-producing systems can become less efficient. When nerve cells do not have enough energy, their ability to maintain themselves and communicate properly can decline. It is similar to a phone with a weakening battery. The phone may still function, but it may respond more slowly, and certain features may not work as reliably. The third important factor is the body's ability to absorb and use certain nutrients that are essential for nerve health. Nutrients support the maintenance of nerve structure and the production of the protective layers around nerves. After the age of 60, the digestive system may not absorb nutrients as efficiently as it did earlier in life. This does not mean something is wrong. It is a natural change that occurs over time. However, when nerve cells do not receive the support they need, their ability to maintain healthy communication can gradually decline. Another important mechanism involves blood circulation. Your nerves rely on a steady supply of oxygen and nutrients delivered through tiny blood vessels. These vessels act like delivery routes, bringing essential support to each nerve cell. As we age, circulation can become less efficient, especially in the hands and feet, which are the farthest points from the heart. When nerves receive slightly less oxygen and nourishment, their performance can be affected. This can contribute to sensations such as reduced sensitivity or altered feeling in the extremities. There is also a natural slowing of repair processes in the body. Earlier in life, your body could repair small amounts of cellular wear and tear very quickly. After 60, this repair process still happens, but it may take longer. Nerve cells are especially sensitive to this change because they depend heavily on consistent maintenance. Think of it like maintaining a road. When repairs are done quickly, the road remains smooth. When repairs take longer, small cracks may remain longer and affect how smoothly traffic moves. These changes are not signs that your body is failing. They are signs that your body is adapting to time. Your nervous system remains active and capable, but it becomes more dependent on proper internal support. Understanding these mechanisms helps explain why nerve-related sensations may appear gradually and why supporting the health of nerve cells becomes more important with age. Your nervous system is remarkably complex and resilient. Even after decades of use, it continues to function, communicate, and adapt. The goal of understanding these changes is not to create worry, but to provide clarity. When you understand how your nerves work and what influences their health, these sensations become easier to interpret and less mysterious. I remember a patient named Margaret, who was 68 years old, when she first mentioned something that, at the time, seemed small to her. She told me that her feet felt different, but she struggled to explain exactly how. She said it wasn't pain, it wasn't weakness. It was more like her feet didn't feel as connected to the ground as they used to. She noticed it most in the morning when she stepped out of bed. The floor felt slightly distant, as if there was a thin layer between her and the surface. She wondered if it was just stiffness from getting older, and for a while she ignored it. Over the following months, she began to notice other small changes. She told me that when she walked outside, especially on uneven pavement, she felt less confident. She wasn't falling, but she felt less steady than before. She described it as if her body needed more time to understand where her feet were. This made her anxious, not because something dramatic had happened, but because she sensed that something subtle had changed. She was an active person. She enjoyed gardening, walking to the market, and standing in the kitchen preparing meals. These were ordinary moments, but they mattered deeply to her sense of independence. What Margaret was experiencing reflected exactly what we discussed earlier about nerve communication. Her nerves were still functioning, but the signals were not as sharp or as immediate as they once were. The protective systems around her nerve cells had gradually changed over time, and the efficiency of signal transmission was slightly reduced. It was not sudden, and it was not catastrophic. It was gradual and quiet. What made it difficult for her emotionally was the uncertainty. She did not know whether this was normal aging or something else. She worried privately, even though she appeared calm on the outside. Another patient, Robert, who was 74, described a different but related experience. He told me that he first noticed it in his hands. He was holding a coffee mug one morning and realized his fingers felt slightly numb. He could still hold the mug, but the sensation was different. He described it as if he were wearing a thin glove that he could not remove. At first, he thought he had slept on his arm incorrectly. But when the sensation returned again and again, he began to pay attention. Robert had always been very independent. He lived alone, drove himself, and enjoyed working on small repairs around his home. The numbness did not prevent him from doing these things, but it made him more cautious. He told me that he felt frustrated, not because he could not function, but because he did not understand why his body felt unfamiliar in these small ways. He wondered if he was losing control, and that uncertainty made him uneasy. What Robert was experiencing was also connected to the same physiological changes that occur in the nervous system over time. His nerve cells were still alive and functioning, but the efficiency of signal transmission had been altered. The protective layers, the energy supply within the nerve cells, and the circulation supporting them had all changed gradually. His body was still capable, but it required more support to maintain the same level of nerve clarity he had known years earlier. What both Margaret and Robert shared was not just the physical sensations, but the emotional response to those sensations. They were not in severe pain. They were not incapacitated, but they felt uncertain. They questioned whether what they were experiencing was normal, whether it would worsen, and whether they would be able to continue living the lives they valued. What helped them most was understanding what was happening inside their bodies. When they understood that these changes were often linked to natural shifts in nerve support, energy production, and communication efficiency, the fear began to fade. Knowledge replaced uncertainty. They no longer saw their bodies as unpredictable or failing, but as changing systems that required awareness and care. Their experiences reflect something very important. Nerve-related sensations often begin quietly. They do not announce themselves loudly. They appear gradually, in small ways that are easy to dismiss at first. But these early sensations are your body's way of signaling that internal systems are evolving. Understanding this process brings clarity and reassurance, and it reminds you that these changes are part of a larger, understandable biological journey. The most important thing you can do is begin paying gentle attention to the signals your body is already giving you. Your nervous system communicates in quiet ways. It does not always announce changes loudly. Instead, it speaks through subtle differences in sensation, balance, and coordination. You may notice that your feet feel slightly less sensitive to the floor, or that your hands take a moment longer to fully sense objects. You may feel occasional tingling, mild numbness, or a sensation that is difficult to describe but clearly different from before. These changes are not always dangerous, but they are meaningful. They are your body's way of reflecting its internal condition. It is important to understand that nerve health is not influenced by one single factor. It is shaped by a combination of aging, circulation, nutrition, overall health, and the body's natural repair processes. One common misunderstanding is the belief that nerve-related sensations always mean permanent damage, or that they can be instantly reversed. In reality, nerve function exists on a spectrum. Nerves can be supported, maintained, and protected, but they require time, consistency, and proper evaluation. There is no single universal solution that applies to everyone in exactly the same way, because every individual's body and medical history are different. Another important point is that not every sensation is caused by the same underlying issue. Two people may feel similar tingling or numbness, but the reasons behind those sensations may differ. This is why thoughtful medical evaluation is so valuable. Your physician looks at the full picture, including your overall health, medical history, nutritional status, circulation, and neurological function. This allows them to understand what your body specifically needs, rather than relying on general assumptions. It is also essential to approach any discussion of vitamins, supplements, or health strategies with balance and caution. Nutrients play a supportive role in maintaining normal nerve function, but they are only one part of a larger system. Your body is interconnected. Your nervous system, circulatory system, and metabolic systems all work together. Any decision involving supplements or changes to your routine should always be considered within the context of your personal health profile. It is never appropriate to stop prescribed medications or replace existing medical care based on general information alone. Your physician understands your individual health needs and can guide you safely. I always encourage my patients to view their health as a partnership between their awareness and their medical care. Your observations matter. When you notice changes, even small ones, they provide valuable information. These observations help your physician understand how your nervous system is functioning over time. Together, this creates a clearer, safer path forward. It is equally important to remember that aging does not mean losing control over your health. Aging is a natural process, and your body continues to function, adapt, and respond throughout every stage of life. Your nervous system remains active and capable. With awareness, proper support, and thoughtful medical guidance, many people continue to maintain comfort, stability, and independence well into their later years. Please remember that the information shared here is for educational purposes and is not a substitute for personalized medical care. Every person's health situation is unique. Decisions about supplements, medications, or health strategies should always be made in consultation with a qualified healthcare professional who understands your individual medical history. This ensures that every choice supports your safety, your well-being, and your long-term health. Your body has carried you through decades of life, experience, and resilience. It deserves patience, understanding, and care. When you listen to it, support it, and work together with your healthcare provider, you create the strongest possible foundation for maintaining your independence and quality of life. I'm Dr. Linda Harrison, and I want you to know that these changes are understandable, manageable, and something you do not have to face without clarity and confidence.